Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry, Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the number one podcast for patient advocacy, affirmation, and education. This week, we bring you a solo episode, yours truly, and I'm going to be talking about how I, as a hospital physician, has been dealing with the coronavirus since it really kind of came into fruition in the public eye and kind of shut down really the world. So we're going to be talking about what it's like to deal with pre-COVID life in the hospital setting, as well as what it's like kind of dealing with it in the now, right? Because obviously we are still in the middle of dealing with this virus that has affected so many. We'll talk about how many, and unfortunately, how many people have died, unfortunately, here in the United States and really across the world. So again, like always, if you have not had a chance, remember to rate us 5 stars, hit us with a 5-star comment, let us know, what you feel about the episode or just what you feel about the podcast in general, and subscribe, and, tell not one, but tell 10 friends, to subscribe and join the Lunch and Learn community here with yours truly, Dr. Barry. This podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. At the store, you can get your favorite t-shirts, coffee mugs, even wristbands, and more. For a limited time, you can get 10% off your next purchase using the coupon code EMPOWER10. That's EMPOWER10, EMPOWER10. Just go to shop.drbarrypr.com to pick up your purchase and get 10% off today. And remember, 50% of your purchases will be donated to the 5-Star Scholarship Foundation, a nonprofit organization for high school students. And thank you again for joining another episode. You're truly, guys, Dr. Barry. So another solo episode. We haven't done this, a solo one in a while, right? I was looking back. I think it was like episode 139 last time we did a solo episode. So I wanted to kind of refresh my podcast audience on the coronavirus and, more importantly, I think what it's like to be a hospital doctor with all of this kind of going around. For those who follow me on my in my group, definitely join the group if you not had a chance. For those who and link will be in the show notes to join my group, as well as on my YouTube page. I've kind of talked about what is the coronavirus. By the time you're listening to this video, there's likely no way you don't know what is it in general. But I do have not one but 2 different YouTube videos to kind of discuss kind of the meat and potatoes of what is the coronavirus in general. For those who really want to know specifically, what is the coronavirus? That YouTube video is for that. This one, we're going to just kind of assume that you know what the coronavirus is, right? Because it's obviously affected you, especially by the time you're listening to this episode. But more importantly, like, what is it? What has it done to me as a hospital physician? For those who know, I am a hospital doctor, meaning I take care of patients who get admitted to the hospital. And my ultimate number one goal is to make sure they leave the hospital, right? That's something I tell my residents all the time, that the goal anytime you see a patient, especially in an emergency room that you're going to admit to the hospital, is to make sure that they can leave the hospital, right? Because it is unfortunately not guaranteed. And with the coronavirus as it is, right, and we'll get into some numbers later, it is not a guarantee that you'll be walking out the hospital because of this virus, right? So let's kind of talk about, I want to kind of talk about it in different stages, right? Right now, I want to talk about the pre-COVID life as a hospital physician. So going on into like the January, February timeframe, right? Because COVID really took over really in March. Early in that March timeframe is when everything started like really happening as far as the lockdowns and conferences being canceled and NBA and all these other sports associations essentially saying, no, we're not doing it anymore. So it really started happening around March. So January, February timeframe, there were essentially kind of whispers of this virus kind of coming out of China, but really did not hit over here in the United States at this time. So
majority of our, I guess, kind of our workload really dealt with what we call like the bread and butter related issues, as far as pneumonia and the flu and, various infections and heart attacks and strokes and those things that we typically see in the hospital setting. Now, what happened, especially with Corona? What happened with Corona? It was one of those things that, unfortunately, we were not prepared for. As you can see, especially when I talk about some of these numbers of, number of cases, number of deaths here just in the United States versus kind of the world. It was something that we were not prepared for. And it was something that, as a hospital, especially here, I practice at Wellington Regional Medical Center. So it was one of those things where like we had to kind of brace and change a lot of our different tactics on how we were going to treat patients, because here comes this disease that we actually have no textbook to refer to. And that's one of the things that I don't know if people realize, especially in the hospital setting or just in medicine in general. Majority of the time we have, references that we can relate to when we're dealing with our disease processes that tell us how to treat. Right. So it's almost like, well, I read the book and I know how this typically gets treated, so this is how I'm going to do it. But here you have this virus that you have no playbook on. So just from, shout out to the sports reference, right? You have no playbook on this virus that's coming to your front door, right? Like this, it's not a scenario of whether will it come? No, it's coming to your front door. And we had no playbook on it. So the preparation that really had to go down to get ready for the cases, an influx of cases that we knew were coming, were really remarkable. And again, shout out to Wellington Regional Medical Center and, all the administration over there for doing such a wonderful job at getting us prepared. I know you guys, especially if you watch on TV or read on the news or blogs, we talk about, a lot of the equipment shortages that were there. Now, I can tell you, there was never a day where I did not have, my PPE and my face mask and everything else. But I will tell you that we definitely did have to stretch it. And it was something like, again, my old infectious disease doctor, as an attending, when I was a resident, he would say that, your PPE is almost like gold. Like it was something that, you just didn't get rid of, because there was a lot of times when I was a resident, we would take care of a patient. We would go into the room with the PPE and then, we leave the room and then we throw it away. Right. And he's like, no, never do that. So he kind of ingrained it in me to always keep my PPE. So that's just something I always have done. I've always been a person to just kind of keep it like in my pocket, especially if the patient that I'm taking care of is still there. But what happened, especially with everything going on with Corona and everything else, was that once the virus hit, right, and you've seen the market, right, like everyone buying up the PPE, everyone buying it up, all of a sudden you had hospitals around the country who did not have it. So fortunately for us, we had our equipment. We just didn't have as many as we wanted, so we did have to stretch it out, and wear for a lot more days. I think we had to wear ours for like 5 days. In fact, we still do have to wear ours for about 5 days before getting a new one. They had to the point where we had to kind of lock it up. We had to put it in, certain areas that only certain people could get to, right? Because people were taking more than they should. And that was, again, really kind of the preemptiveness of Corona, right? Again, it hadn't really hit us yet, but just that level of fear that we knew a disease process was coming, that, were we really equipped to handle it? Because we didn't know, was there, that, it caused people to take, gloves, it caused people to take masks, and all these things started missing that usually weren't missing, started to occur, right? So that's kind of what the preemptiveness of Corona kind of did to our hospital. And as a hospital doctor, like I said, I'm still taking care of those patients. Like those patients are still coming. But like, as we move on to the stage where Corona is here, and actually in my hospital, I actually took care of the first Corona patient who came to the hospital, right? It was a very crazy story. HIPAA reasons why I can't say what the story is that kind of brought this person to the hospital, but like very crazy story. But like, I took care of the first Corona patient that we had in the hospital. And, that level of fear, like I remember taking care of this patient, and they were first diagnosed with the coronavirus, positive for COVID-19. And you should just see just the level of fear that surrounded the patient, the level of fear that surrounded the nursing staff, the level of fear that surrounded the physicians, and even especially my residents, to the point where, obviously we talk about mental health and, wellness all the time. Like, we actually excluded our residents, especially on the medicine service, I should say, on the medicine service, we actually excluded our residents from seeing the COVID-19 patients, right? Like, because I could just see that their psyche just was not ready for that. Again, they're watching the news as well, right? They see, other residents, and they see other physicians and other nurses and other technicians get sick and die, from this disease, right? So, that panic and worry is definitely there. So, on the medicine service, our core faculty, we actually decided, what, we're just not going to let you guys see the patient. Like, you don't have to actually see the patient, which I know is definitely different at different hospitals. And again, it's really fortunate. Again, we lucked out that we were just able to do that. Some hospital systems are not able to do it, where, again, residents have to see. But at least at our hospital, we were able to do that, in which we did. Moving forward, we're taking care of the first patient, and then another patient comes, and then another patient comes, and another patient comes, and then all of a sudden, now patients who may have it start coming, right? So now we're in the mid stage of the coronavirus and COVID-19, right? So now we're getting hit with patients who have it, who may have it. And at the time, testing just wasn't where testing is now, especially if you're listening to this, the day of the recording, where, we would have to send out a test and we'd wait maybe 3 to 5 business days to see if a person was positive. And some patients even longer, like it just, because of the influx and everything else. So for some people, it took even longer, 7 days, and I don't mean business days, to see if you had a virus. So imagine having to be taking care of a patient for 7+ days, not knowing if they have this virus. And very tough, right? It's very tough from a mental aspect. It's very tough, just from just a general physical standpoint, a staff standpoint, just, all these things is kind of working, onto not only yourself, but onto the patient as well, as we're kind of moving forward, right? Again, and what's happening, especially now that we're in the thick of things of the COVID-19 kind of crisis, what started to happen, when I talk about those bread and butter cases, the heart attacks, the strokes, the flus, the infections, everything else, all of a sudden those numbers actually started going down. Right. And what we try to theorize, right, especially, us, the medicine service, the emergency room services and everything else, is that the level of fear was so gripping for a lot of people, across the country, that, maybe they weren't doing as much activity as they used to do. Or unfortunately, they were like putting off going to the hospital because they didn't want to be around any COVID patients. And that was something I heard a lot. Like, I heard a lot of patients say, yeah, I should have came sooner, but I didn't want to be around any patients with that virus. So it was a level of fear that was now keeping patients away from the hospital, even for things that wasn't related to the COVID-19, but just because of the fear of proximity, they weren't even coming to the hospital, and some people were coming later than they should, right? So here, as a hospital physician, not only am I now dealing with patients who have or may have the COVID virus, but I'm also dealing with patients who still have stroke, still have, pneumonias and things else, but they're coming in much later. So they're coming in actually much sicker than they would have came in if they would have just came in on the regular time, right? So as a hospitalist, you're kind of juggling all of these different aspects of care and acuity. And again, you're still worried about, like, you're worried about, like, hey, I got to take care of my patient who may or may not have COVID. 2, I got to, make sure I don't get COVID, right? And I'm actually going to talk about a nice, interesting story about that, that happened like a few weeks ago. And then you're worried about, like, I want to make sure I don't bring it to anyone else, because as a hospital doctor, or really just anyone in the healthcare field, one of our biggest fears, right, because obviously, we're all about taking care of the patient, right, wasn't necessarily the fact that, yes, I don't want to make sure I get it, which it probably was. It definitely was. It was up there. Trust me. It was like maybe 1B, 1C. Most important is that I don't want to be responsible for giving it to others, right? I don't want to be the person who, like, maybe I'm a carrier and I didn't give it to somebody else. So that was something that was, very heavy on a lot of our minds, especially in our hospitalist group and around from a resident standpoint, is just not wanting to be the person who's responsible for giving it to others. So as a hospital doctor, you're dealing with all these stressors here. And then because hospital administration is, doing things like our hospital, we were having to change areas, like areas that used to be, medical ICU are now COVID units. And then there were units that used to be medical floors, and now they were, let's see if they have COVID floors, and all of these different changes that's happening inside the hospital from an administrative standpoint as well is kind of going down amongst the pandemic of sorts, right? And again, and we're hearing the numbers, we're seeing the numbers, right? We're seeing, patients come in and not doing very well. Because I could tell you, we had a lot of patients who came in with the coronavirus, right, and ended up intubated and ended up sicker than, we've ever seen. So again, remember, we don't have a playbook. So we were actually writing the playbook as we're taking care of patients. There was things that we were doing in March for patients with the coronavirus that we don't do now, right? Because something, came out and they're like, oh, and this study here says you shouldn't do this, and that study here says you shouldn't do that. So imagine being, in the middle of the game, right? In the middle of the game, having to rewrite your playbook because what works or what they said don't ever do in March, they're actually allowing us to do because they see like, oh, it maybe ain't as bad as we thought. In May, right? So this is kind of the timetable that as a hospital physician, we've been kind of dealing with. Like we've been dealing with just this up and down approach of medicine. We've been dealing with the change in just the way we had to practice medicine for all of the disease cases, right? Because once the pandemic hit and hospitals really started cracking down across the country, one of the biggest things they did was they stopped visitors from coming into the hospital. And visitors, of course, was the family, right? They stopped. Families couldn't even see their family members as they were ill, right? And imagine sending your family member, and you hear about this deadly virus, right? And you send your family member to the hospital not knowing if they're going to come back. And if they don't come back, you're not even allowed to be there at the final moments because, again, we can't risk giving you COVID, right? We can't risk giving you the disease that's going to succumb and take your grandpa away, that's going to take your uncle away, that's going to take your mother or brother or sister away. We can't even do that. Right. So now you're having to do a lot more counseling for families, via the phone. Right. There are some families I even had to FaceTime just so they can see their loved ones. Right. Just because they hadn't seen them. Right. And that was very tough as a hospital physician. Right. Understanding, that level of concern and grief that these family members had, right? Like I said, again, there's some times where the family members, they're not local, so they're typically calling out and say, that's one thing, right? But imagine being, physically able to go see a relative in a hospital, but literally not being allowed to because it wasn't medically safe to, or a hospital, guidelines said you can't, right? So that's a lot of the things that we've had to deal with kind of with COVID. COVID-19, kind of being where it's at. And it's been such a struggle for the hospital physician because we understand that this is a way of life that's not going to change for a while, right? Despite all of the things that are happening, despite all of the, businesses opening up and everything else. And I've told my patients all the time that when these businesses and these states reopening are not because medically we're doing so much better with COVID, is that, business wise, businesses had to open, right? And it was becoming a more of a calculated risk. Like, hey, you know what? We're going to open up, but, we're going to force people taking masks. We're going to force people doing these types of things there, right? So that's kind of where, the business is opening up, kind of came into play, right? Because again, as I record this episode, right, just to kind of give you the numbers so everyone's kind of fully aware of where we're at, we have had 103,000 deaths, right? In fact, specifically, we had 103,700 deaths here in the United States, right? As I'm recording this, and we've had a total of 1,761,503 cases of COVID-19. Period. Here, and this is just the United States, right? So this is a disease that is here. it is not going away, right? And I'm going to talk about this in our, I guess, I don't want to say post stage because we're still really kind of in the middle of it, right? But in the post stage, right? This is a disease that's not going to go away. This is a disease that is going to flare up again. So we have to be wary of that. And I want to just tell you about a personal experience I had just kind of dealing with COVID-19 and just dealing with the hospital setting in and of itself, right? So last about 2 or 3 weeks ago, depending on when you listen to this, right? So let's say early May, right? Early May, right? I have allergies, right? So typically on a year-to-year basis, I usually will get a bout of like really bad sinus flare-ups that usually then kind of precipitates into a bronchitis flare, right? That's usually the scenario that happens usually once or twice a year, right? So no biggie, no surprise whatsoever. This episode that I actually got picked up was much more severe than normal, right? It was because I typically, I'll take my antibiotics, I'll take my Afrin, I'll do all those things there to get over the sinus infection. Then when the bronchitis types of flare, I may get like a Medro dose pack. It's kind of a steroid dose pack to kind of help me breathe a little bit, then I'm kind of good to go. But this year, this one hit me way harder than expected, right? To the point where I ended up having to go to the ER, right? I ended up going to the ER, one, because my wife was freaking out and thought I was like gonna like pass away, right? So like I had to do that just to kind of appease her, right, more than anything else. Right? But again, I felt let me just check the ER out, get a breathing treatment, get a quick X-ray, and I was diagnosed with pneumonia, right? So now it went from sinuses, which I typically get, which is from bronchitis, which I typically get, but now I have like full-blown pneumonia, right? Unfortunately, guys, this is the worst time to get pneumonia. Right? This is probably the worst time to ever get pneumonia, right? Because here I am, a hospital doctor, right? Who takes care of patients with COVID-19 every single day, right? And now all of a sudden I have pneumonia. Guess what you think the hospital also thinks I have? COVID-19 as well. Now, mind you, I didn't have any of their clinical symptoms related with COVID-19. And like I said, check out those 2 YouTube videos to kind of learn about some of the symptoms, pathology associated with COVID-19. So I didn't have any of those symptoms, but I was just short of breath, right? And I was a little wheezing, right? And that's all they needed to know. So they did the first time I go to the ER, they give me a breathing treatment, they give me an albuterol inhaler, they do the COVID test is negative. Great. Fine. I think I'm all good to go. But my bronchitis was so bad that I ended up having to come back like the next day. I was like, I can't even make it down the steps without me like huffing and puffing, right? So I ended up going back the next day. And then, of course, again, here's this doctor. He works in the hospital. Boom. Let's check him for COVID. They checked me again for COVID, right? But this time, right, they were like, you know what? This is the second time coming in. Let's just, keep you in the hospital. Make sure we're not missing anything else, right? So I get admitted to the hospital setting, and I get this. First of all, I get put in the COVID risk area, right? Because again, here I am, a hospital doctor who takes care of patients, and yes, I have pneumonia, but I have negative COVID. And this is one of those things where I say we are just we are just kind of writing the playbook as we go. What typically happens, especially for patients who get the rapid COVID testing, right, is that we know COVID testing has a very high sensitivity, right? Meaning that if you have COVID-19, it will likely pop up positive if the COVID-19 is in very high virulent state, right? Like if you're in like the middle of a huge flare of COVID-19 and I swab your nose, it's going to come up positive. But let's say you're let's say you're a low grade COVID-19 patient, right? Like if you're a low grader, right? Like I may swab you and I may not pick up anything, right? So our specificity is low, right? Which means that specifically, can I say you have COVID? It's kind of low, right? But sensitive, like if you do have a lot, I'll pick it up. Right. So now I get the second test, right, again, to come to the hospital, like to come before I'm admitted to the hospital. And then my doctors come to see me. Right. And then I'm explaining to them again, the same story that I'm explaining to you guys. And then they don't believe me that my COVID test is negative. Right. Like, no, the sensitivity is, not good and everything else. So then they do it not once, 2 more times. So I end up getting this COVID-19 test 4 times in the hospital, guys. And it's a painful test, guys. Again, those who may have gotten the test already, it's a painful, annoying test that makes you tear up every single time. All negative, right? And then they swab me for the flu, which interesting enough, because of just the timing, it almost seemed like once COVID-19 came around, like the flu stopped, right? Because I haven't diagnosed a flu in probably 3 months, right? Literally right when COVID came around, it was like the flu, go out of here. So, and again, I'm going to talk about this towards the end. That's where I talk about we got to worry about COVID. But here I go. They test me for the flu. They test me for all these different respiratory, bugs just to make sure, right? Everything's negative. And they're like, oh, I guess you have the pneumonia, right? So here you have this setting where if it was in January, I would have gotten some antibiotics, maybe got some steroids, and I would have been on my way. But because of the pandemic, and I think this is what patients may fear as well too, that maybe I just have regular pneumonia, but I'm getting treated like I have COVID, right? And that happens a lot, right? Where, I have patients, I got patients in a hospital that I see that have been swabbed, not once, not twice, three times being negative. And there are still people who think, no, you have to have COVID, right? And as a patient, it's first of all, it's terribly annoying, right? Because they keep wanting to swab you for COVID. Oh, maybe now it pops up positive, right? But then I always say well, is it positive because I already had it? Or is it positive, right? Because you gave it to me, or a nurse who's working with me gave it to me, or I'm in this room where, people could give it to me. Again, we don't know. In that regards, right? So, I experience, right, the other side, right? I experience, being sick, right? But unfortunately, it's almost, again, it was almost as if they wish I had COVID, right? Because that would have made it so much easier for them to do something, right? But because I did not have it, right, they're like, well, I guess you just got pneumonia. And I'm like, yeah, I know. I've been saying that for 3 days, 4 days, but here we are. So yeah, obviously I'm much better, right? Because the podcast is back. Like I said, we actually took some time away from the podcast recording just because I was kind of out sick and to myself. But again, we're fully back and full back at work. So everyone who a lot of people checked up on me. So shout out to everyone who checked up on me. I am okay. I'm great. I'm doing well. I'm back at work. For that standpoint there. But I think that's what we need to think about kind of moving forward, right? And when I say moving forward, as states are opening up, cities are opening up, and businesses are reopening up again, and we are going to see an increase in COVID. It's just going to happen. Unfortunately, guys, I don't want to sugarcoat it, right? We're going to see an increase in COVID, right? Just because now all the groups are going back. And again, if you're, depending on when you're really listening to this, right now, protests are happening all across the country. And it's unfortunate, right? It's unfortunate, right? Another Black man murdered by the cops, right? And that has brought, people out in droves. But what's going to happen again, and that's as a Black physician, as a Black person in general, right? Like I 100% understand why you got to be out there. And then what's unfortunate as a physician, I'm like, oh my God, there's going to be a lot of patients with COVID now, right? Because I know that's what's going to happen, right? So a lot of different reasons to expect spikes to occur. I can tell you once cold and flu season comes back around again, we're going to see another spike again occur in, that time frame of COVID-19. You're going to have patients with COVID-19 and the flu, right? And pneumonia, right? So again, all of these things, again, could also always be true, right? So I see this 103,000 number. That's going to go up. The 1.7 million number, that's going to go up, right? We just have to be very wary and concerned, with this disease process. But I can tell you as a hospital physician, we are ready. We are prepared. We are much smarter than where we were, 3 months ago, about 3 months ago. So we will be prepared to take care of you, right? And it's very interesting, again, especially as I'm dealing with, residents who are going out into the hospital life as attending, or even new medical students are coming into the residency, right? It's just very interesting to know that they're going to kind of grow up in a time and train in a time and work in a time where we're dealing with a virus that the playbook is still being written on. Some cases are being won, some cases are not being won, but we're learning along the way, and we're hoping, we're striving to bring this down, right? Again, 103,000 103,000 deaths, is just too much. Right. It's just too much again. And again, remember, we're talking about a 3-month time span, guys, 3-month time span for 103,000 people to die. Right. Like we've had families die. Right. Like this is not a disease that I want to make sure we are not sugarcoating, especially, as the summer months, especially as cold and flu season comes around. This is a disease that's going to be here. And again, I know all these people are waiting for like the vaccine and everything else, right? But again, social distancing, keeping the mask on, those are going to be your 2 most important things that you're going to be able to do to kind of help fight this disease and, fight your ability to see me, right? Because if I tell my patients all the time, especially in the hospital setting, you don't want to see me. I'm the hospital doctor, right? I'm the last person you want to see. And this is a very important time where the last person you want to have to deal with is the hospital doctor, right? Like, now, of course, if you got your heart attacks, you broke your hip, all those things, please come to the hospital. Don't avoid us, right? Because that's one thing I don't want you to do. I also don't want my bread and butter hospital people who typically have to come to the hospital, COPD, asthma, my bronchitis folks, right? My bronchitis family, right? I don't want you guys not to come to the hospital because you're afraid of COVID. I still need you to come, right, and get taken care of, right? Because we rather take care of you in an early stage than have to deal with you in the later stage, right? So that's those are my multiple cents here, just kind of dealing with COVID-19 and how I as a hospital physician, I as a program director are kind of dealing with it on kind of multiple fronts, and understand that we are here to take care of the patient. This is disease that we know that we're gonna get ahead of, but it's just gonna take some time. Right. And unfortunately, you guys are kind of, especially I mean my patients, right? You are in the middle of kind of the battleground, right? Kind of dealing with a lot of these fronts, right? So we're going to be here. We're ready to take care of everything for you guys. And really, the most importantly, we're going to reach out to your families. We're going to make sure your family members are aware and okay. We're going to try to calm the fears and qualms and everything else. And that's why we do what we do here on the podcast, on the YouTube page, just to make sure that you guys get as much, viable information, truthful information as you can about this disease process, so you can better prepare yourself and your family members, right? So that's me. Again, that's my solo episode for this week, guys. Again, like always, hit us with the 5 stars. Let us know, what you thought about today's episode. And again, like I said, I am better. I'm feeling good. I'm feeling great. Thanks everyone Thanks everyone who shout out to everyone who were looking out for me and wondering where I was at because they hadn't seen me on social media for like 2 weeks or so. You guys are great and amazing. And I'm gonna see you guys next week, guys. Bye.
Thank you for coming to the end of the episode. It is yours truly, Dr. Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lynch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222. And you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.